The impact of COVID-19 on the global economy has been huge and devastating. International trade has suffered, and the price of crude has become even more volatile, affecting the capacity of countries like Nigeria to provide the fundamental needs of its citizens. But there is an emerging argument that COVID-19 has perhaps unwittingly exposed corruption and mismanagement of public resources in many countries, particularly in low and middle income countries. Joining us now to expand the conversation on this is Professor Oghenowede Eyawo, thank you, a global health epidemiologist at the Faculty of Health, York University, Toronto, Canada. He received a BSc in zoology from University of Benin, an MSc from the same discipline from Karl Franz University, Austria, and a master's in doctorate and public health with a specialization in epidemiology from Simon Fraser University, Canada. Professor recently wrote an opinion titled COVID-19, A Rude Awakening for the Political Elite in Low and Middle Income Countries, and that will be the focus of this conversation. Welcome to the program. Good morning, Professor. First of all, I need to apologize for butchering your name. I practiced and practiced. I'm just not very good with names. You can imagine how long it took me to learn how to pronounce epidemiologist. It took me like several weeks. I'm so sorry. Thank you for joining us this morning.
Thank you, Professor Eyawo. Good morning.
Thank you very much.
Thank you
very much for having me.
Yes. Well, let's start, as Tondo pointed out, with the essay you published recently about COVID-19 and a rude awakening for the political elite in low and middle income countries, LMCs. Now, how rude is that awakening? And what are the obvious lessons that the political elite will need to learn? And, I mean, are you sure that these political leaders, even if they learn the appropriate lessons, are you sure they have the political will or even the capacity to turn the challenges of COVID-19 into opportunities for the betterment of the people's lives?
So, you know what? First, thank you for having me on the show. It's exciting to talk about this article, which is getting a lot of attention globally. So first, the issue is this. In Nigeria, we've seen for decades the suffering and death that has resulted. Can you hear me all right?
Yes, you can, Prof.
Yes.
Okay, good. So we've seen the suffering and death that has resulted from inadequate healthcare system. And people in this country, they're dying from preventable and treatable disease, which is a problem. So I'm trying to give you a premise of how the article came about. You know, so when COVID started, everybody was thinking it's going to overwhelm low and middle income country settings and Nigeria. And as scientists and people who have concern in global health, the first concern we're thinking is, what is the root of this problem? And the root of the problem goes all the way back to our leaders. And when I'm talking about leaders, I'm talking about leaders over the last couple of decades, okay? So first, what has put us in this situation? I think I like to address that first, which has to do with the neoliberal ideologies, which has been largely permeated through the system, This whole idea of individualism, focus on competitiveness, privatization. So these are some of the issues that led us to where we are, okay? So I'll put the issue into context again. Just look at the global burden of disease in low and middle income countries, for example. I'll start with the life expectancy of births, let's say in a place like Nigeria. Okay, in Nigeria, the life expectancy of birth is about 54 years for men. For women, it's about 55 years. In a country like Canada, where I live, people are expected to live as long as 80 years for men, and for women is 84. That's a difference of almost 30 years. So the question we ask, and this is the question we've always discussed in policy cycles, is why do we have this substantial difference between life expectancy and death in a country like Canada compared to Nigeria? Okay, and this brings me to the leaders. Part of the reason is because of the conditions that the leaders in many low and middle-income countries, including Nigeria, have created. Okay? Many people do not have access to clean water. Many people cannot afford health care. The circumstances that determine whether or not people are healthy, as we have argued in the article that we're discussing, is largely determined by the conditions under which people live in these societies. Okay? And these conditions are a result of the political choices made by governments. So far, until COVID came along, it didn't seem like we, as the populace or people who live in these settings, we've not been successful in appealing to the elites, the political elites, in getting them to do what is necessary to assure that the conditions under which citizens can be healthy is maintained. Okay? We believe one thing is for sure, self-motivation. Before COVID came along, there was no self-interested reasons for investing in healthcare by the leaders beyond the fear of being of revolt or being voted out of office. Perhaps now that their own health and the health of their families is at stake, perhaps that may be sufficient enough reason. That's the argument we're making in this article. For once, for the first time, just because of the restrictions around the world, travel restrictions, these leaders can't just hop on a plane and jet out. So we're hoping the conditions that COVID has imposed can force them to recognize how important it is to adequately invest in the healthcare system. That's the argument. So we hope COVID would make that happen.
We hope so. And from your phrasing of the article of the title of the article, A Rude Awakening, you've phrased COVID as this great leveler, which you've just described. The political class have seen that they have made this bed made of bad decisions and they must lie in it. You can't fly off somewhere else. You can't snap your fingers and magic PPE all of a sudden. But I do wonder if these people are still sleeping, because this is not the first health crisis that we've had. If we want to call Ebola sort of a warning shot, surely some preparation should have been made then. Nothing was done. Earlier on today, we were talking to our previous guests about the fact that the federal government has revised the budget and has slashed the health budget in the middle of a pandemic. The irony of that is completely lost on them. So are you really convinced that this is the impetus that the political class need to change? Or do you think that when the crisis blows over, it'll be back to business as usual?
To be honest, I think the best person to answer that question would be the government officials themselves, okay? What we can do, we can only hope. I think COVID is unlike any other disease that has come to face us in the last century, okay? Ebola is not of any scale near COVID. It was mostly localized in a few countries. COVID, on the other hand, is a global problem, okay? It is a global problem, and everybody, I mean, we are actually hoping. I mean, for any leader who's reasonable, this is like a wake-up call. It's essentially a wake-up call. So we can only hope, but your question can best be answered by our leaders themselves. We hope COVID gives them that realization why they really, really need to invest in healthcare, in universal healthcare coverage for people who live in low and middle income countries, including Nigeria.
Well, you referred to the fact earlier on that Africa seems to have defied predictions in terms of the numbers we have seen with regard to COVID-19. And many Africans like to celebrate this. We have also seen that countries of the South, perhaps with the exception of Brazil and Ecuador, we seem to have done much better than the countries of the North, even with their sophisticated health infrastructure. Now, what do you think is responsible for this difference? Is it that these developing countries are not testing enough, or that, Africans in particular just have a strong immune system, which is helping to keep the numbers low?
No. It's got nothing to do with the immune system. That's a fallacy. It's got nothing to do with the immune system. I don't think Africans have anything special. So that notion of Africans having some things, we hear sometimes it's got to do with the weather. Maybe it's so warm in Africa, that's why the numbers are not so high. I think part of the problem is, you mentioned the case of Brazil. Okay, Brazil is a very unique case. As you know very well, the president of Brazil, even till this day, does not fully support efforts geared at minimizing exposure, minimizing transmission to COVID. So part of the problem is the lack of political will. And that's the reason why you see the numbers in Brazil are so high. Something like this also happened in the early days of HIV, if you remember very well. South Africa, as you know, they have one of the highest prevalence of HIV in the world. And part of why it was so bad then was also because the government at the time, Thabo Mbeki, it was of the argument that HIV and AIDS was not real. So I think that's part of the reason why maybe Brazil, the numbers are going skyrocketing so high. What I think is happening, and part of the reason I believe the numbers in Africa are a bit low, has to do with the demographic of Africa, okay? Africa is the continent that has the highest proportion of young people anywhere in the world. As what we're beginning to learn about COVID is that COVID is a disease that affects everybody, but it's more severe among people who are older, okay? So the case fatalities we're having, like for example, in North America, where the numbers are it's crazy over here. Like, people are dying. And it's because the population of old people in these settings are quite high relative to Africa. So I guess our young age in Africa is in a way, it's helping us. That's one reason, okay? Another reason, if you follow the data very well...
Professor Eyawo, would you please hold your thoughts? We just need to take a short break and we'll be back for more with you. Please stay with us. Welcome back to the morning show here on Arise News. We're still with Professor Oghenowede Eyawo, a global health epidemiologist in Canada. Thank you for staying with us. Would you like to finish your answer to Dr. Abati's question about why Africa seems to be confounding the experts so far?
So I guess the last point I'll make on this has to do with testing, okay? It's likely we're not testing enough relative to these other settings, okay? In other places, they've conducted quite a lot of tests. In Nigeria, we're not testing as much, and that's part of the strategy by the Presidential Task Force on COVID, who in fact they're doing a very great job. I think the low testing numbers relative to other places is also part of the reason why the numbers are low, at least in Nigeria.
Thank you, Prof. Now, as you mentioned earlier, COVID-19 is a different kettle of fish from previous outbreaks that we've seen. This is unprecedented in terms of social disruption and the effects on the economy. But what are your thoughts as a professional in this field on whether or not, why are you laughing? On whether or not it's safe to discontinue stay-at-home orders at this point? Do you think it's premature?
Oh, definitely. Absolutely. Don't even go there. No. It's definitely premature. It's definitely premature to discontinue those stay-at-home orders. But I'll use this opportunity to raise another point which I think is an issue, okay? So in the first place, if you notice how the measures that are taken around COVID-19, they were designed with the intentions, with the capacity of high-income countries, okay? The pandemic preparedness response, they remain focused on the interests of high-income countries. I'm not saying the point I'm making is a completely different case, but what happened is high-income countries designed, oh, let's use restrictive measures, and everybody just jumped on the bandwagon, okay? We argue, okay? We're arguing, I believe, COVID, the approach to addressing COVID requires a more than a one-size-fits-all. People in most societies, they have living arrangements that would allow for physical distancing, for example. In Africa, or in parts of India, that's not the case. It may not be even possible. There are people who live, just think about some of the slums in Lagos. How are people going to social distance in this setting? So I guess the point I'm using this opportunity to make is I'm raising an issue about how the rest of the world, especially low and middle income countries, how they just ran away with the measures designed in mind for high-income countries. One point I need to make, when high-income countries came up with these restrictive measures, they also, in parallel, they offer their citizens a lot of safety net. So in Canada, for example, okay, people who, because of COVID, can't work or stopped working, the government is paying them as much as $2,000, and this will continue for 4 months, okay? This was part of the old design. Now, countries in low and middle income countries, including Nigeria, we just accepted these measures without also planning for parallel palliatives to support our populace. So I think right there is also another problem. Most low and middle income countries just accepted these strategies, which were created out of some flawed expectations without due consideration for the context, for the capacity and the arrangements in these low and middle income country settings. So that's something I just wanted to point out, use this opportunity to make.
Well, Prof, I see that you've done a lot of work in the area of HIV/AIDS, particularly with regard to antiretrovirals. And now we're told that we've reached a point where HIV/AIDS is no longer the giant killer that it was once thought to be. How soon, given the status of research into COVID-19, how soon do you think we'll reach that same point with COVID-19? Or we should just accept COVID-19 as a permanent affliction?
No, we can't accept COVID-19 as a permanent affliction. How soon, I can't tell you, okay? The reason is because we're still learning about COVID as we go along, okay? We're still learning about COVID. We still don't fully understand. There's so much uncertainty around COVID. You see certain jurisdictions, they will have a meeting today, politicians will have a meeting today and say, we think we should reopen the economy and get people back to work. The next day, the numbers go up again. So there's just so much uncertainty around how the transmission is happening. There's so much we still don't understand. So I think the restrictions have to be in place. We still have to continue to observe, and then the strategies we take will be dictated mostly by the data. That's the approach I think we need to take, and that's essentially what they're doing in Nigeria at this time.
And speaking of what they're doing in Nigeria, what is your assessment of government's public communication at federal, state level, and the NCDC? Do you think that the message has really been driven across properly as it ought to be?
Absolutely, absolutely. I'm quite proud of what the Presidential Task Force on COVID is doing in Nigeria. You know, let's just put things in perspective for a second, okay? Let's compare the case numbers and deaths in Nigeria to that of high-income countries like the US. And then you appreciate how well we are doing, okay? As of this morning, I looked up when I woke up this morning, I looked up the NCDC website, and I believe we have, as of today, June the 3rd, we have about 10,819 cases and 314 deaths. Okay, unfortunately, 314 deaths. Now let's compare that with the US, okay? With all the investments in healthcare, with the US has like close to 17% of their GDP is committed towards healthcare. They have about 1.6 million cases and over 106,000 deaths. Okay, now talking about the deaths, I'll use worry as an example. I believe the population worry is like, about 500,000 people. So we're talking about the people that have died in the US are roughly about 20% of the population of people who live in worry. I'd like you to visualize that for a second. So just putting things in perspective, I think the presidential task force, they've done very well, and I hope they continue to do the good work.
Well, Prof, one of the points you raised in your essay is about corruption. How, in specific terms, do you see COVID-19 pandemic as a pandemic of corruption? And would that apply to every country, both the countries of the North and the countries of the South?
COVID is a clinical issue. So in terms of the disease itself, I don't think the disease has anything to do with corruption. Okay? It's a clinical problem, it's a health problem. But the argument we're making in the article, by the way, I want to acknowledge my co-author, Professor Adrian Jens, a very good colleague of mine. We co-published this article together. And the point we're making in the article is that because of corruption and permeation of neoliberalism in African societies and in low and middle income country settings, we're not very well equipped to respond as well as we ought to do. Okay? So I guess that is the issue. That is the issue. What COVID has helped us demonstrate is why neoliberalism in particular has not helped LMICs, which is the term we use for low and middle income countries. It doesn't help them focus or prepare for this pandemic, okay? So there isn't enough support for public health and the social determinants of health, and elites have always thought they will have access to private health care, or they will just be able to fly abroad if they need care. COVID changed that. That is the argument. COVID changed that. So we are hoping COVID would actually make them wake up and think for a second and say, hey, if this is the healthcare we're creating for the rest of our citizens, now we're having to experience it. Maybe it will make them have a rethink and do the right thing, which is investing in healthcare, creating a robust universal healthcare system that can, and then create environments and the conditions that can help people be healthy. I think that is very important here, because it is the conditions that people live that determines whether you're
Absolutely. Thank you, Professor.
Thank you very much, Professor Eyawo.